From allergies to zinc deficiencies, hangry to hay fever, we provide easy-to-absorb information to improve your health. It sounds like health on Texas A&M Health Talk. Howdy, welcome to Sounds Like Health. This is Mary Lee Meyer.
I'm the co-host, Sam Kraft.
And we are here with a registered nurse, Ms. Wendy Creighton from the School of Public Health. Thanks for joining us.
Thank you for having me today. I work with the Center for Population Health and Aging through the School of Public Health.
Perfect. So I guess we'll get started. There are multiple types of diabetes. Is that correct?
Right. Yes. So there's several types. There's what we call prediabetes. There's type 1 diabetes, type 2 diabetes, and then gestational diabetes. So, prediabetes is something that we have talked a lot about recently. It's kind of that term in which we bring up a lot lately. And the reason is because prediabetes is a condition that can occur while you don't even realize you have it. So you could be sitting here, 9 out of 10 people who have prediabetes don't even know they have it. Symptoms are pretty much unknown, and it really occurs over time. So prediabetes is basically when people have blood sugars that are above normal but are not high enough to be diabetic, in that diabetic range, or to have
so just
diabetes.
Like hinting at they're about to develop diabetes.
Right. And some of the risk factors for that would be sedentary lifestyle, so not exercising or sitting at your desk all day, or not being active. And then the other risk for that is obesity. So one of the things that we really try to stress is to have people become more active. And the American Diabetes Association recommends that people who have prediabetes or any type of diabetes exercise 150 minutes a week. So that equates to about 30 minutes, 5 to 6 times a week. Mm-hmm. And then the other thing that we try to recommend people to do is to lose about 5 to 7% of their body weight, which people think, oh, well, how much is that? Well, if you weigh 200 pounds, you're looking about 10 to 15 pounds. So it's not really that much weight when you think about it, and it's really doable. And I think that that's what we have to really encourage people to understand, is that this is not some huge thing that that you're required to do. It's just to make these small changes to really make a difference. And the wonderful thing about prediabetes, if there is a wonderful thing, is that prediabetes is reversible. So if you can manage your weight and you can exercise, you can prevent it going into diabetes. So prediabetes is like that precursor to diabetes. Mm-hmm. So,
and is the exercise recommended because it has those weight loss benefits, or is it because of all the other health benefits that exercise comes with?
Both, really. So not only do you lose weight when you exercise, but you can lower your blood sugar. Mm. You lower your blood sugar through exercise and weight loss. And then the other thing, too, is when you are exercising, you tend to hydrate yourself a little bit more. When you hydrate yourself, you can have a lower blood sugar too. So those are some things that we recommend people to do.
So with the other types, I know there's 1 and 2, and that's always the type of diabetes I've always heard is 1 and 2. Mm-hmm. I actually lived with a roommate of mine that had the insulin pump, and because he just lived with the pump. Is 1 you're born with it, and 2 it's brought on by other factors in life, or is it just a bad lifestyle, or can you go into that explanation of some?
Right. Yes, sure. So type 1 diabetes, you're correct on that. So type 1 diabetes is going to be the type that you are either born with, or you can have an autoimmune disorder. They don't really know what causes type 1 diabetes. They're thinking that what happens is your pancreas, which creates insulin, it's an organ in your body, it creates insulin. And what insulin does is insulin helps lower blood sugar. So when you eat a piece of food, okay, say for a piece of bread, for instance, you chew it up, you swallow it, goes to your stomach, and then it gets absorbed into the bloodstream. Well, in order for it to get moved from the bloodstream into the cells need energy, and they get that from the food that you eat. But if it's in the bloodstream, it has to get to the cells. Insulin is the transporter. So it moves the sugar from the bloodstream into the cells. So if you don't have enough insulin, then the blood sugar, that sugar in the blood, isn't going to get moved into the cells where it needs to go. So then here you are with high blood sugar, which is called hyperglycemia.
Just really lazy organs, it sounds like.
Yes. Well, what happens is you have these little cells called beta cells on the pancreas. That may be too technical, but that produces the insulin. And if the beta cells aren't functioning properly, then there's not going to be enough insulin that's supplied. And if you have an autoimmune disorder, or what can happen is your body can attack those beta cells and it shuts down those beta cells from producing insulin.
So with type 1, are you not born without those beta cells, or is it just there's some other factor affecting
Right.
those
Well,
beta
you can
cells?
be born with the beta cells, and then over time the body destroys it. And at some point over time, your body will not, your pancreas will not make any more insulin.
Okay.
And that is why people who have type 1 diabetes have to have insulin for their entire life. They don't take pills, they take injections, and they need that in order to sustain life. They need the insulin to sustain life.
So in today's world of fast food and just our lifestyles in general, is type 2 really the one you see the most, or is there any numbers that say type 1 is way more prevalent than type 2 or anything like that?
Yes. So the majority of people who have diabetes have type 2 diabetes. Type 1 diabetes is only found in approximately 5% of the people who have diabetes.
5%?
5%. So the majority of the people that have diabetes have type 2. And type 1 diabetes can be diagnosed most likely in childhood, but can be diagnosed as an adult. A lot of people think that, it's called juvenile diabetes. You've heard that term before. I don't know if you have, but it used to be called juvenile diabetes. And it used to be, people think, you can only get that when you're a child. But that's not the case.
And
it can be diagnosed in adulthood as well.
And that has nothing to do with lifestyle diet. It's just random.
Right. Most
by
of the
chance.
time, what they're saying, the risk factors for those would be, for type 1 diabetes would be if you have a close relative that has had type 1 diabetes in the past, type 1 diabetes, that could be a risk factor as well. So.
Can you go into more about type 2? I mean, it being the most prevalent one, because, there's all this research and I guess the health campaigns now are diabetes and diabetes and diabetes. And I didn't realize it was just 5% that it's just not naturally occurring. So it really is the way we live our lives. It's really affecting this diabetes crisis.
Right. So type 2 diabetes is caused by another reason, or what happens there is your pancreas makes insulin. And it goes to, that insulin will pull the sugar from the bloodstream. But what happens is your cells can be resistant to that insulin. So I like to think of it as your cells being a house, and the insulin is the key. Well, in order to get into the house, you have to unlock your doors to get in. Well, if that insulin, which is the key, is not able to get into that lock, and say the lock is malfunctioning, then you can't get into that house. So it's the same thing with blood sugar, with the glucose. The sugar in your blood gets trapped there unless the key is able to turn and move that glucose from the bloodstream into the cells. So the cell becomes a little bit resistant to that. It may be that lock isn't working very well. So that causes the cells to not be able to uptake the glucose. So it still sits in that bloodstream and it's trapped. So that's one of the causes of type 2 diabetes. So some of the risk factors for type 2 diabetes would be age. If you are over the age of 45, you have a higher risk. Ethnicity. So if you are African American, Hispanic, Native American, or Asian American, you can be at higher risk as well. And then some other things, if you have had a history of gestational diabetes, so that would be females who have had diabetes or been diagnosed with diabetes in pregnancy, that would be considered gestational diabetes. If you have had that during pregnancy, you are 50% more likely to get type 2 diabetes down the road.
Oh, wow.
Yes. So we really try to mention that as an important risk factor.
And how do people get type 2 diabetes? Why is that so much more prevalent than...
Right. So it's interesting because as we look at studies from obesity and, obesity studies along with people who have had diabetes in the past, we see this trend that as obesity rises, so does diabetes. And it has to do with that resistance factor of insulin. And so as people begin to gain weight and become sedentary, that is how they are more likely to get type 2 diabetes. So when you also think about it, as our children are growing up and they are more sedentary, they tend to gain weight because they are not active. They don't go outside. They play video games. They aren't out riding their bike or climbing trees or doing whatever it is. Then they are also at greater risk for type 2 diabetes. So,
from the food aspect of things, most people that are obese or overweight tend to eat junk food, worse food. I guess it goes without saying, are there better foods that help keep you away from type 2 diabetes as far as fat content or cholesterol? I know junk food is junk food, but specifically the actual content of said food. Sugar is obviously there.
Right.
But along those lines, is there anything that we should watch out for?
Yeah. So
if you're a small, healthy person and you're over 45 and you eat really bad, you're still at risk, right?
Are you asking if some foods are better than other foods, or if there's a superfood for diabetes?
I don't know if there's a superfood for diabetes, but one of the things that we teach in our class is called the plate method. And what the plate method entails is to have half of your plate. So if you were to take a plate and divide it into quarters, half of your plate should be filled with vegetables and some fruit. And then a quarter of it should be filled with protein, and a quarter of it should be filled with carbohydrates. And we really like to emphasize complex carbohydrates that have whole grains, that have fiber, because those foods can lower blood sugar and also make you feel full. So if you have foods that are really high in simple carbohydrates, the donuts and the pizzas and the sodas, those types of foods are going to increase blood sugar very quickly because they are metabolized very quickly into the bloodstream. And then you tend to have this fall of blood sugar. So we really recommend that eat high fiber diets that can help with diabetes.
So we're talking about food, and we said the sugar in food. This is always kind of gets me. To me, there's a misconception that if I eat a bunch of sugary foods, I'm going to get diabetes. Well, it's not so much the sugar that you're eating in the foods; it's just the quantity of junk the non-quality of carbs and the other stuff that you're getting out. The nutrients are not as good. Is that really the main cause?
Right.
Of it?
Well, I wouldn't say that that's the main cause. The main cause is going to be a sedentary lifestyle and obesity.
Okay, so it all comes together in one big package.
So one of the most important things that you can do if you have type 2 diabetes is exercise and lose 5 to 7% of your body weight. And that's across the board, along with then, again, medications and eating healthier foods and monitoring your blood sugar. So that is one of the really those two important aspects of diabetes are key.
And what about fruits? Some fruits have a lot of carbohydrates?
They do.
But those are good.
Well, some of those, you have to eat those in moderation. They do have carbohydrates.
Avocado is good fat.
Right. It is good fat.
In moderation.
Right. In moderation. So we really, we stress in our classes to really make sure that you can have a fruit, but what consists of a carbohydrate serving. So we teach carbohydrate counting. And what is a carbohydrate? A carbohydrate is a macronutrient that we have to sustain life, but it doesn't mean that that's all we eat. We need to eat a variety of foods, but teaching people what a carbohydrate is and then how much to consume throughout the day will really open people's eyes and make you think, okay, well, I can have a fruit. I just have to recognize that fruit has, 15 or a couple of carbohydrate servings, and so I can have a banana or half a banana, or who can eat half a banana?
Well, it's so hard to think of food like that. I mean, just is dealing with it that I have. I think it's hard to break down your food into a mathematical equation for the day. I think that's the hardest thing for me.
Well, it's very eye-opening, though, because it really makes you pay attention. And that's the overall goal, is to help people pay attention to what they're eating and to make small changes. It's not about making these huge changes. It's about doing it slowly at a time, a little at a time.
Have you been to a dietitian at all, Mary Lee? So I recently went to one, and she had these vials of sugar placed out, and I was like, what are these? And for each one was, this is how much sugar is in this, and this is how much sugar is in this. And that, if you ever get a chance, look it up online. It is the scariest thing you'll ever see, and it will make you think about what you eat and how much you intake of it.
Yes.
It's just so scary.
But I'm quite happy in my blissful ignorance.
So it's interesting that you bring that up, because one of the things that we bring up heavily is the terms or the saying, rethink your drink. So instead of drinking soda and juices, which are very high in sugar, we really try to emphasize, all right, we'll go to water or switch to drinks that have no sugar, whether that's diet soda or no fruit juices at all. Because when you think about your drink, you can have a 20-ounce soda and you could have 60 carbs.
Oh.
That is a meal.
Well,
That
all
the
the sugar
amount
that
of
comes with it.
carbohydrates, right? The sugar that in the amount of carbohydrates in that one 20-ounce soda is considered how many carbohydrates you could have in a meal. So that is, and not only that, think of the cost savings, right? Hey, so yes, that is something to consider. So one thing I wanted to mention is to talk a little bit about what a carbohydrate is. So a carbohydrate can also be known as a sugar or glucose. It gets broken down into the body as sugar or glucose. So sugar and glucose are used interchangeably.
So for the people living with diabetes, are there any health risks that are associated with having diabetes? Are there any doctors people should try to go see regularly now that they are diagnosed with diabetes?
Yes. So we usually try to make sure that people who have diabetes go to their physician every quarter to have their labs drawn to make sure that their blood sugars are within a certain range. We usually tell people that if they have a hemoglobin A1C, which is a technical term for the average amount of an average blood sugar reading over a 3-month period of time, should be less than 7%. And a lot of people who have diabetes, that's the magic number. So going to the doctor regularly to get those numbers, those labs checked. Go to possibly an endocrinologist if you have type 1 diabetes, or even if you have type 2 diabetes for a long period of time. An endocrinologist is a physician who specializes in endocrine problems or problems with hormones and different things like that. So especially with diabetes, they specialize in diabetes. Mm-hmm. So we recommend that. Also having people go see a podiatrist or foot doctor 1 to 2 times a year to make sure that their feet are able to be inspected, and that especially if they can't, look at their feet. Another doctor that people with diabetes should see regularly is an ophthalmologist or an eye doctor, because diabetes can lead to blindness or, due to complications in the long run. And that can be something that certainly you would want to address.
I've never heard that before. I've never heard. It's always been for me. It's always been I can't feel my feet, or I lose my feet. I didn't know it was your eyes. Well, what else can be affected?
Pretty much everything. And the reason is because the way I like to look at it is that diabetes is a vascular problem. Because blood sugar is sugar or glucose is in the blood at high levels all the time, it can cause all kinds of complications in the bloodstream, in the arteries, in the vasculature. So anything that has to do with your heart, so it increases your risk for having a heart attack, it increases your risk for having a stroke. Diabetes can also affect the retina in your eye, due to high pressures and in the eye, which can cause blindness. And that is why you need to see an ophthalmologist or an eye doctor once a year if you have diabetes.
So as we wrap up, I think my biggest takeaway is with type 1, it's something you can be born with. It has nothing to do with people's lifestyle, unlike type 2, which has everything to do with people's lifestyle.
And it's 95% of people have type 2 diabetes.
Right.
That is unbelievable.
That's right.
As we wrap up, can you tell us a little bit about what people need to be on the lookout for? What kind of symptoms would first manifest?
Right. So, and this can be for type 1 or type 2 diabetes. Typically, people will notice that they have increased thirst. They get super thirsty, and all they can do is drink. And then they may have an increased appetite. So they may be eating normal, and then they just continue to eat, because what's happening is the blood sugar is staying high in the bloodstream, and it can't get to those cells. So it causes you to be hungry. The other thing is increased urination or having to go to the bathroom a lot. So you may find that you're drinking so much, but you're having to go to the bathroom all the time. You may be fatigued, irritable, because your body is trying to compensate for these problems. So those are the major symptoms of type 1 or type 2 diabetes.
One more time, what's the best way to prevent type 2 diabetes?
So type 2 diabetes is most preventable if you exercise and you maintain a healthy weight. So, that would be, and by going to the doctor. If you can go to the doctor and get your annual checkups and get your blood work done and get your labs taken care of, and you know where you stand and your doctor can be on top of that, then that's another really key part.
Well, that was some good information. Hopefully people understand a little bit more about what to look out for. And if you haven't had your annual checkup, go get tested. It can save a lot of trouble in the future. Thank you for being here.
Thank you so much. I had a great time.
Really enjoyed the time. I appreciate it.
Thanks.
And thank you for listening to Sounds Like Health.
Thank you for joining us on Texas A&M Health Talk, a production of the Texas A&M University Health Science Center. Visit us on the web at vitalrecord.tamhsc.edu, where you'll find answers to all of your health questions. Until next time, stay healthy.